All right, Lois, so let's talk about a slip disc. Actually, there's no such thing as a slip disc. That is a myth. The discs don't actually slip. They can bulge or they can herniate or sequester, and then over time they can degenerate, but the disc itself does not actually ever slip. In fact, the disc is much stronger than the actual vertebrae. If I was to take a hammer and smash down on top of your spine, the vertebrae would explode before the disc ever gave way. So, in fact, the discs are even stronger than the bones. But what happens with most people is they have bad lifestyles, or they have bad habits, or they have a car wreck or a trauma, or played contact sports or gymnastics as a kid, and it moves the spine out of position. It locks that vertebrae or the two vertebrae out of alignment, and it causes that disc to begin to dry out because the discs have to move in order to stay healthy. When a disc moves properly, it pulls in fluid from the outside tissues and pulls that fluid into the disc and keeps it healthy. So when the discs don't move, they begin to dry out. Kind of like an old car in your grandpa's front yard that is sitting there, and as you're mowing around it, and the tires on that car begin to wear down and deteriorate because they're not ever moving. So similar analogy with the spine. So with a bulging disc, we see the disc material actually start to protrude or push out toward the nerve root, where it can compress the nerve and cause, if it's in the neck, it can cause pain in the neck and the shoulders and down the arms, and cause weakness or tingling in the fingers. If it's in the lower back, it can cause the back pain, hip pain, numbness, tingling, or weakness in the leg. So if you think you have a bulging disc, or you've been told you have a slip disc, please come and see us. We'd love to see if we can help. We have a ton of resources and options, from decompression to regular chiropractic care to tons of other options to get you well without drugs or surgery. So if you're interested, give our office a call. We'd love to see if we can help.